For what purpose does the gentleman from California rise?
Thank you, Mr. Chairman. I have an amendment number 9 at the desk.
The clerk will report the amendment.
Amendment number 9, printed in the congressional record, offered by Mr. Cardoza of California.
The gentleman from California is recognized for 5 minutes.
Thank you, Mr. Chairman. I rise today to offer an amendment that would require the GAO to conduct a study that highlights the impact that elimination of funding would have on the number of physicians that would be trained if this program were allowed to continue as intended. Countless studies have demonstrated a serious and growing shortage of health professionals facing the United States. Most critically, a shortage of primary care physicians and dentists. However, where I come from, there's also a shortage of specialties as well. With an existing shortage well established and an aging population increasing, our country desperately needs investments in the healthcare workforce, not rescissions. In my home state of California alone, there are 567 designated health professional shortage areas, which include a population of more than 3.8 million medically underserved individuals. In California's central San Joaquin Valley, there are already less than 87 primary care physicians for 100,000 patients of population. The doctor-patient ratio in my region is not getting better, it's getting significantly worse. That is why I've consistently advocated for the need to improve access to care and address this vital shortage. All 8 counties in the San Joaquin Valley have been designated as medically underserved by the Department of Health and Human Services, including Merced, Stanislaus, San Joaquin, Madera, and Fresno counties. At one point, a few years ago, we were down to 1 pediatrician for the entire county of Merced. With the passage of the Affordable Care Act, we were able to include additional funding for these medical residency programs to help address the mounting healthcare profession shortage in already established underserved areas. The new Teaching Health Center's graduate medical education program is intended to be an investment that helps struggling underserved communities deal with the reality of increasing demands on an already strained healthcare system. Studies have shown that the most effective way to attract and retain new doctors in underserved areas is to allow medical students to complete their medical residency programs in the communities that are in need. Graduating physicians most often practice in the communities where they have completed their residency training, which is why this program is uniquely important. My wife is a perfect case in point, a primary care physician who stayed in our community and practiced for 18 years after she finished the program. Without these critical investments, the lack of care will most certainly have a costly price on health and well-being of many rural, underserved communities, including those that I represent. Mr. Chairman, I reserve the balance of my time.